This is COVID-19 hot topics and practical advice, a question and answer with Dr. Hammond. We had our first one last week, and people had really great questions and found it very informative. So we hope this builds on that. Thanks for those who submitted your questions already. We have a great list of questions we'll start with. And once we get through those questions, if you have any additional ones, we will take it from there. This is 30 minutes, so we'll do our best to answer as many as possible. And if there's still more questions at the end, we can certainly host another question and answer, as this is a topic that is constantly changing and evolving. So there will always be new information, and we can trust that Dr. Hammond will research it all and stay up to date for us. Other things to keep in mind, let me go ahead and our next upcoming webinars, this is something that we're going to be doing for a few more weeks. Hopefully we get to continue it after that too, but we have some other webinars always on Fridays at 10 a.m. Next week, I'll be teaching a Mediterranean Diet 101 during COVID. So what do you do with all those items in your fridge that you don't know what to do with, and how can you eat healthy when there's less access to food? So feel free to sign on for that. These are all free. The following Friday, May 1st, we'll have Dr. Dumont, who's our clinical pharmacist at our clinic, and she will be talking about the different medications and the myths out there regarding COVID-19 and medications if you have specific questions there. Following that, on May 8th, we're going to do an info session on direct primary care. For those who have who want different type of options instead of insurance, or who maybe lost their job and don't have insurance, direct primary care is a package deal where you get all of your care actually we're doing a special right now for $99 a month for all your access to primary care, and a lot's included with that. So we're going to do an info session for those who might be interested in going that route instead of some of the traditional commercial insurances. And then we'll do another one following on May 22nd. If you have ideas or want to see other types of topics for webinars, feel free to shoot me an email, stacy@westminstermedicalclinic.com, and that's EY for my name, or go onto the website and you can see the ones that we have posted. And then lastly, just to let you know, we are still open. Our clinic is open as well. We're doing televisits by phone, by video, and in person at the clinic. We're still doing visits. Our hours are 8 to 5 right now. So please let folks know we are accepting new patients. So if you have friends or family who are looking for primary care, we would be more than happy to help them out and be their doc. With that, I'm going to turn it over to Dr. Hammond. Thank you again for being here. And Dr. Hammond is our medical director and a co-owner of the clinic, and knows everything. So with that, that's his bio. We'll turn it over.
Well, I know something about most things, but I'm not sure I know everything. So thank you for joining, and it was nice to see some faces of old friends before the videos were cut down. But this session, again, before there's some new folks, so I just want to say I'm giving general information. I'm not giving medical advice for any specific problems. Those should be discussed with your provider. I will let you know if I think that should happen. I'll try to answer these questions the best I can. You will find that a lot of the answers are depends on this, depends on that, because the information is uncertain at this time. It's not actually been proven. The information changes on a daily basis. So it is very hard to give you a black and white answer. I'll give you the best opinions from a medical clinical perspective. I think we have about 10 questions today, and then we'll get to any chat questions that are that come up, and if I can't get to them, I will try to respond by email. So the first question is, if I don't know I have COVID and I deliver groceries to my elderly parents who have no contacts and are isolated, will they get sick, or can they get sick? And the answer is yes. Uh, the current thought is that maybe 20 to 25% of people are asymptomatic and that they do not know they have the disease, or they could be in that incubation period of 4 to 5 days before they get symptoms. And as we discussed last week, you are infectious at least 1 to 3 days before you have symptoms. So if you had a contact and you're in that incubation period and you have no symptoms, you may be infectious. So going to your elderly parents who are high risks should be done with caution. And for example, I had to deliver some information or packages to my pregnant daughter, and I met her outside with a mask, and she had a mask, and I didn't go inside, and I kept it, a very much isolated event. So in this case, going to your parents, if you have to deliver groceries, you might leave them on the front porch and say hello from 6 to 10 feet away. If you have to go inside, wear masks and be sure that any parts of the house that you touch are actually washed down. This is a serious matter, and it's incredible how infectious this agent can be. So you need to be careful and assume that you are infectious when you are going out and meeting somebody who especially is high risk. And I think everybody's on mute. So if you have follow-up questions to my explanation, either unmute and just pipe in, or put it in the chat and I'll try to get to it. Second question, are face masks intended to protect the wearer, others, or both? And it is both. Face masks, despite there's so much information out there. There's accurate information, there's misinformation, there's self-interest information, there's general lies out there. So it's hard to know. There's lots of myths. The fact is that masks will certainly not help the person wearing the mask not give COVID to somebody else, but also it does protect you if you do not have COVID. Not as well, and it depends on the mask that you wear, but it is somewhat protective. So I think that you will see, and I think that they said that in New York already. They made a law that everyone has to wear masks, and that is to protect others and to protect yourself. And we went through some of the data on that last week. Just even cloth masks can decrease the amount of virus that you're exposed to by 40 to 50%, depending on the fabric that you use and how well it's sealed against your face. So it is helpful. It's not 100%, but it is helpful. Can a person get COVID a second time? Don't know. There is some data coming out of China saying recently 150 people or so have tested positive after having had COVID. Well, there's a lot of issues about Chinese data accuracy and whatnot. So I'm not sure what to make out of that. Was the first test accurate? Did the person ever really get rid of their COVID? And is it a reactivation? If they're reactivated, are they actually infectious or are they sick? I was listening to a webinar from the State Public Health Department this morning, and they were telling us that yes, there is our episodic positivity in convalescence. So after you get COVID, your test can turn positive and negative and turn positive and negative. No one really knows what to make out of that yet. We do not know if that means you still have the disease, and if you're still infectious, it just means the test is positive. So don't know and depends. Are waves of burning and irritation and pain centered around the sternum or my breastbone a sign of COVID? with only minor other symptoms such as a headache and a flush. And again, don't want there this really requires a dialogue with your provider because there are a number of questions that would be in my mind exactly what's going on. Like many diseases, COVID is one of those things that can really present with many different symptoms, and it doesn't always follow the textbook, which is being written like as we speak. So probably not. Burning irritation under your sternum can be many things. It can come from your esophagus, from reflux esophagitis, from the stress of COVID. It could be unlikely to be a heart symptom because burning and irritation is not usually a heart symptom, but it depends on how people perceive their senses and their feelings. And so that's why it requires a really more questioning to understand, well, could this be coming from your heart or your lungs or your stomach or your esophagus? Or other, could it be stress, whatever. So that's a dialogue I would recommend calling up the office and getting a televisit with your provider to really do a deep dive on that to be sure you're okay and to give you suggestions on what to do. Some general information on keeping your home safe. That's a long answer. We do have information on our website, www.westminstermedicalclinic.com, that on the front page, if you scroll down, there's a COVID link, and we have a lot of information from the CDC and other areas that go over this. Again, it depends. Are you a health worker bringing home germs? Or are you out and about still working? Are you isolated? Are you going to the store and then coming back? So, you keep your house safe according to what your risks are. And, basically, is there anybody in the house sick? Is there other people in the house who are going out and coming back in? So it depends. Keeping your house safe basically would be to be sure that you're using proper social physical distancing when you're out, wearing masks and whatnot. When you come back in, just washing your hands and washing your hands, and being sure any surfaces that you touch that you clean. If after you bring in the groceries or come in, and touch the doorknobs and stuff like that. Does plasma from recovered patients really work? Is it scalable? Well, they are taking plasma from patients who recovered from COVID and getting their antibodies, and then infusing those antibodies in people with COVID to see if they recover. And this goes back to the days when we had gamma globulin. Before the hepatitis vaccine, we had gamma globulin, which was the same principle, where we took serum from people with hepatitis A and then injected it into people's butts before they went to Mexico or wherever, a third world country, and that worked. So the results are not back in. This is in trials. They're trying it. It seems plausible. There's some suggestion that it might work, but the studies are not complete. They're not back, so don't know. Is it scalable? Eventually, it would be scalable, but not in the near term. It depends on how many doses of how much serum does a person need? How much serum can you get out of one person at a time? And, then get it, sterilized and manufactured properly to become injectable is going to take time. And it really is probably not going to be scalable with the number of people who have COVID. Probably what will happen is the drug companies will find the antibody, be able to clone it in the laboratory by doing some genetic manipulation of bacteria, getting those antibodies. That would be scalable. And that is doable because we have that technology. How long that would take to do not know, but it certainly is something in the near future, if it works. Where and when should we be wearing masks? And I would say all the time you're outside, absolutely, without question. If you also would need to wear a mask if you have a sick person in your home. The sick person in the home should be wearing a mask. They should be isolated in their own room. And when you go into that room, you should be wearing a mask. So to me, wearing a mask right now is a no-brainer, and it's going to be an important part of re-engaging back into our social connections again when we go out. And people who do not wear masks are being irresponsible, dangerous, foolish. So hopefully I'm clear on that. When will when will there be widely available testing, and can you get tested to see if you are a silent carrier or had it before? And this is another big subject. And this, I have the most current information as of 3 hours ago from the State Health Department on testing. And it is not clear cut. And because so the answer to the question quickly, and then I'll get into some details. Well, when will testing be available? Well, right now, there's different types of testing. There's nasal and oral testing to see if you have the disease, and then there's antibody testing to see if you had the disease. Abbott Laboratories just sent, I think, 1 million antibody tests to this country this week. They're expected to gear up to 20 million tests in June. There's about 20,000 machines now available in this country. So antibody testing is happening. But put that in perspective, the state of Colorado thinks that they would need to have about 1 million to 2 million tests a week to really, control the epidemic. So that we need a lot of tests. And then there's the tests that tell you if you had the disease. Now, here's the problem. How accurate are they? And should they be done at all in regular people who are not very sick? And so we had that discussion at our practice and said at the time, it's not practical or wasn't available to be doing testing in our practice. We have a few tests. We can do it on occasion for very selected people for very selected reasons. As we get back into re-engaging into social contact, we will be doing more testing probably, but here's the problem. The testing is only accurate 1 to 3 days after you start symptoms. Before you have symptoms, when you're asymptomatic, there really is no hard data on how accurate the testing is. Some people say maybe 40% of the people who are asymptomatic will test positive. So it's a flip of the coin, but there is no accurate data to give us a real firm number on that. So can you test if you're a silent carrier? Yes. If it's positive, you're probably positive. If it's negative, it's a flip of the coin, whether you're really negative or not. So not that helpful. Now, when you get sick, there is this window of time of 1 to 3 days after your symptoms to see if and the test is about 75 to 95% accurate at that time. So that means that 1 out of 4 people could be positive and be screened as negative when they're sick. And why is that? Well, a lot of it could be how the test is done or transported, or, and so it's in the laboratory, these tests are really accurate. They're 98, 99% accurate. When you do them clinically, getting the swab in the right place and getting it there the right amount of time and getting transferred into the tube right and getting the tube to the person, there's a lot of places where things can be done wrong and the people may not be testing positive. Also, it's about how many viruses are you shedding that are going, do you have enough RNA to be found? So the tests immediately when you're sick are modestly accurate. Now, when you get past 7 days, 7 to 14 days, the tests are only 30 to 50% positive. So if you're really, 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 really sick and you're in the hospital and it's been 7 to 14 days, the test is going to be positive half the time. If you have mild symptoms at the 7th to 14th day, the test is going to be positive a third of the time, or 30%. So again, a lot of people are being missed. And so is that good to get tested? Well, yes, but it could be causing some harm. You might think, oh, this test is negative and I'm okay, or I'm no longer infectious, and that's not true. So it takes some judgment about whether to do testing. And this is a big problem because as we try to re-engage society again and get back to work, we are going to be heavily dependent upon testing to make that happen. And so I think that the jury is out exactly who's going to be tested. We are going to be talking to the state health department here, hopefully in the next week or so, to see if we can become a testing site. Because I think really primary care doctor offices really need to be the testing sites. It's going to be just a zoo if you have to go to places and be in long lines. And so I think this is a way we can kind of partner with the state health department. I think it's part of our responsibility. So hopefully we'll be doing testing, more testing. We can do a couple now, but again, we really reserve it for people we really need to know who are high risk. You do need to know if you're positive, if you're in the hospital, and sometimes it's really kind of important to know if you're positive, if you have someone sick at home. But right now, the testing is, there's room for improvement. Let me just put it that way. Will we be doing testing? Again, I'd mentioned we do have a few tests at the office. We reserve them for certain cases, so that becomes a clinical discussion between the provider and the patient whether it's worthwhile. I think you can see we need to be able to have enough tests for the hospitalized patients, and we need to have enough tests to test healthcare workers. Then those are the priorities. If we have enough tests, then we can test other people. And there's a lot of money to be made with testing. So I am sure we will have a lot of testing materials here in the next month or two. And some just general information where we're at. And it's, again, we're in a funny zone right now. I think we're in a kind of a plateau. If you can see me, we look at curves, and there's many different models of these curves, but in an epidemic, it starts out slow, it gets very, very, very high, it kind of peaks out, and then everyone's getting it, and then it starts getting better and better, 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 better. So with the social distancing, we really blunted that curve, so it's not a very high peak. And so we did not overwhelm our hospitals here in Colorado, and we still have plenty of hospital beds and plenty of ICU beds and ventilators right now, because we have blunted the curve by social distancing. So instead of going way up high, we've kind of blunted it out, and it's in this kind of lower peak. So we're in a peak, and it seems to be plateaued. And so it's not this big, big, big spike. It's this kind of low peak. Now, how long is that peak going to go? Okay, I don't know. Is it going to start dropping down and this month or not, or is it going to be going out for a long time? Just don't know. You have to look at, it takes days to see where the trending is at. But from what I can see from the data, it looks like we are what data are you looking at is another thing, and I'm looking at the number of people being hospitalized. That doesn't tell us the number of cases, because we really don't know the number of cases in Colorado every day. So the number of hospitalizations are sort of about the same the last 4 to 5 days. And so we're kind of in this plateau, but we have not dropped. The general information that I understand it to be is that we're really going to be, it's going to be probably into May before we start seeing drops, I think, but it could be in the next week or so that we start seeing a drop by the end of April. And May might be, on the downswing, but the virus is still here, and it's going to be here for a year. And so don't think that we can let our guard down. It's going to be continuing the vigilance that we have and wearing masks and trying to come up with treatments. So I'm going to go ahead. I think we have a question in the chat. My husband and I are very ill in January with coughing and temperature and fatigue. And then the husband again in February with pneumonia. They stayed home because they're so sick. And so I always stayed home from work. And when I returned to seeing patients, I wore a mask and gloves. Is there a chance we could be tested for COVID to see if we had the disease? Again, you would require antibody testing. And here's the problem. How long does antibody testing persist? Well, we checked this antibody called IgG, and it starts to become positive around 2 weeks. But then it starts dwindling. So is it going to still be around 2 to 3 months later? We do not know. It's possible, but that person would need an antibody test to see if they had it. But a negative antibody test doesn't mean they didn't have it. So when you look back to a similar virus, the SARS virus 10 years ago, which is in the same family, that antibody kind of peaked out about 4 months and then dwindled out and gave people 2 to 3 years of immunity. Other coronaviruses, like the common cold that we get every year, those viruses peter out in a few weeks. I mean, those antibodies peter out in a few weeks, and people have maybe immunity for a year. So where does COVID? These are both the same family, and we don't know really how long COVID antibodies last. I think they do last out at least a month, maybe two. So being sick in January and February may be positive, may not be positive. But when Abbott's antibody test becomes available, yes, you could get tested and find out if those antibodies were present, you had it. If they are not present, you don't know. And are patients having headaches with COVID? Yes, they are. COVID is everywhere in your body, can affect every organ in your body. And so, and there's clearly neurological syndromes that we get from COVID, and encephalitis and some strokes and serious issues. So COVID could probably cause almost any symptom, I would imagine, depending on where it sets up shop and how your body responds. So it's a ubiquitous in the body, and can be kind of maddening because you just don't really know what's going on. It can make you kind of crazy. Do I have it? And give you some anxiety, and that can cause all sorts of symptoms too. Come back to remember the fact that still 80% of people have very mild disease and get over it. And again, it's age dependent. And even though after age 20, it seems like every decade of people have about the same amount of COVID. So the 20 to 30 group and the 30 to 40 group and the 50 to 60 group, 70 to 80 group seem to have the same occurrence of disease, but the severity of disease is, of course, really much in older people and people with chronic disease, hypertension, diabetes, and heart disease. Although we do know that half of the adults in this country have one chronic disease, and so lots of people are high risk. So again, we're going to have to deal with this. Most people get over it really well. If you're above 65, be very, very, very careful. Under 65, be very careful when you expose older people, and but be reassured that chances are you will do fine, and not to fret over, every little sign and symptom that you may have. But again, we're open and we're here to get your calls. You call the office, we'll talk to you about it. If we think we need to see you, we'll have you come on in. We are doing televisits and phones visits right now through the end of the month. Insurance companies are paying for these visits. Well, they say they're paying, but they're not actually paying, or they're paying some of it. But that's our problem, not your problem. But there's no cost to you. So if you do have questions, I would certainly call and set up for a visit, and that will help you, and that also will help us be here when this all goes away and we want to still be standing. So I think I hit my time, and that's it for this week.
Thank you all so much for joining. Thank you, Dr. Hammond, for your wonderful expertise. Really appreciate it. We'll probably do another one of these here soon. Let me go ahead and show you the schedule again. So Our next one is next week, Mediterranean diet, if you'd like to join for that. And then dispelling medication myths, and then direct primary care. And maybe we'll squeeze in the week after May 8th, another COVID question and answer with Dr. Hammond. If you have any feedback, we'd really appreciate it. I'll be sending out a survey to your email that you registered with for this webinar. And the survey is just going to ask questions about how this went for you, and how we can improve, or what other sessions you would like to see. So please take a moment and fill that out. I'll probably be sending that out later today. Any burning questions or comments here that anyone wants to chime in with? And remember, everybody's on mute. So if you have a comment, you'd have to unmute yourself. Okay, with that, we hope everybody stays safe and healthy, and we look forward to seeing you on the next webinar.
Bye all. Stay safe.